I first learned about the IASIS feedback system about 2 years ago when a colleague of mine, Barry Bruder, gave me a call and started telling me about it. And he had been using it with his patients. And it took me about a year to get into it because I'm like most doctors, I'm just skeptical about things. But after some interesting things happened, which I can talk about, we did incorporate it in the practice. We've had it going for about a year now. So initially, what happened is Barry was telling me about this and how it was working with a lot of his patients. And then finally, he talked to me about how I was working with Marines with traumatic brain injuries and with post-traumatic stress issues. And at that time, I was working with a doctor who had traveled clear across the country to be in my clinic to get treated for these conditions. He was suffering from severe migraines, and there was a lot of medication involved. And although he was employed, his life was very difficult for him. And so he came to see me. I usually do pretty well with these kinds of problems, but with him, nothing happened. I wasn't able to really help him at all. I worked with him about 2 or 3 months, and then I thought, you know what? He had suffered from a traumatic brain injury. This was 6, 7 years ago, so it wasn't a short time ago, and this is what brought all his symptoms on. And then I thought what Barry was talking about with his work with the Marines, and I thought, you know, maybe this is a possibility. And so for me, this was a test. And this was a chance for me to see how well this system might work in a very difficult situation, a situation basically in which I couldn't do anything. I had failed with this patient. So I sent the fellow over. He got 3 treatments. This was over a 3 or 4 day span. I called him back after he got back to his state and asked him how things were going. He said, you know, for the first time and as long as he can remember, since the accident at least, his headaches were gone. He felt much better. And that's when I began to realize there's something really going on here that's way more than placebo. There's something else going on. When you stop and think about it, it's not that hard to understand. We're talking about a treatment to the brain. The brain controls everything. So it's sort of easy to understand how this could be applicable in almost every clinical situation that you have to deal with. At first, I started using this for the more or less traditional ways, the way that I had learned it was being used. I used it for traumatic brain injury patients. I used it for patients with anxiety, patients with depression, depressive disorders, and a patient with post-traumatic stress disorders. And here's the thing, you know, when we started using this, I didn't just give it to everybody. I saved it for my absolute worst cases, the cases that were basically not responding to anything. And I thought, if it's going to work in, you know, 1/4 of these cases, I'm going to be very favorably impressed with it. So that's how we started to work it. It did work out great, and since I've seen it work, I let my patients know that this is working very effectively, and so patients began to inquire about it, and we started using it in all kinds of other applications besides the ones I just mentioned. And I could tell you some stories, but it's been really remarkable in all the various facets and ways in clinical applications that this can be applied to all kinds of patient conditions, not just the ones I formerly mentioned. I asked my secretary to give me some charts of some of the patients we've been treated. I'm just going to kind of go through these at random almost, and just to give you a little idea of the sorts of things we've treated. Now this first patient is a young man. He's an ex-paratrooper, and he did have some traumatic brain injuries in Iraq. This was about 2 years ago. When we first started to see him, he had been on disability and was not employable, and was suffering from fatigue, headaches, exhaustion. He was also having cognitive disorders, sleep disorders, and some severe anxiety and depression. And the long and the short of it is, after about 3 or 4 treatments here at the clinic, he was infinitely better, much better. So much to the point that at this point he's now working in the clinic. He's actually giving these treatments to some of our patients now. And so he's back to fully employed. He's not totally out of the woods yet, but compared to when he first came in, he's dramatically better. Okay, here's another case. Now this is a woman I have known for many years, and I've treated her for insomnia and anxiety and various pains throughout her body. I mean, the technical diagnosis was fibromyalgia. The long and the short of it is, she's done better. I'm treating her for 4 years now. So she's slowly getting better. She's much better than she was initially. But the improvement has been extremely slowly, and she's still prone to headaches, prone to fatigue, and prone to anxiety and insomnia. Well, we started her on these treatments, the neurofeedback treatments, and within a matter of 2 weeks, she was already telling me that she was much better. I just saw her about 2 weeks ago, and at that point, she told me her mood and her energy are much better. She's getting the regular treatments. All the pains are gone, and so it's another success story there. Let's see this one. Okay, let's go with this one here. Okay, so this is a young man who has been plagued with fatigue issues and a lot of anxiety states, marked anxiety states. He's not employable, and he's had an extremely difficult time of it. He's now about 24 years old, and when I first started to see him maybe 6 years ago, I've known him for quite a long time, he's been managed on medications, basically. And what I can tell you is, he's once again, you know, I start sending the patients in that are really, really difficult for the IASIS treatments. I don't just send the easy cases. This was a hard case, once again, he responded dramatically. Now I think he's almost close to being off all his medications now. He's told us that he's sleeping better than he has in a long time. His moods are much better. His anxiety is level now, and I get reports from his mom. I've known his mom the whole time that he's going through this, and she's very happy and very pleased. And let's see what else I've got here. Okay, so I'll tell you about one more. This woman here has been also another very difficult patient for me, and so I first started seeing her, this would have been a year ago. At that time, she was lifelong depression, completely dysfunctional family. Everybody in this family is on some sort of antidepressant medication. Sleep, she wakes up after 3 hours. She naps in the daytime. Her brain's not quite working well. She has some cognitive disorders. She's weak, she's tired, she's dizzy. If all this sounds kind of crazy, I mean, these are typical of some of the patients I get. Once again, she's a wonderful woman. I've been working with her for over this last year, and we've gotten somewhere. You know, she's done better, but we've never really gotten to that point where, you know, we can see us like breaking through with something. And once again, the IASIS treatment has made a lot of difference. It's actually creating changes in her that are very visible and very noticeable. One of the most dramatic stories that I can tell you about was one of the very first patients that was treated here. This was a 6-year-old boy. I had never known him. He came in specifically for this treatment. And from the time he was 2, he had an accident when he was 2. He had a traumatic brain injury at the age of 2. And he never recovered. He had behavioral issues. He suffered from headaches. And he just flat out couldn't sleep. They could not get this 3-4-year-old kid to sleep. And so he presented on multiple medications, and still with significant disorders, significant behavioral problems, and still, even on the medicines, wasn't sleeping. These were adult medications. within one treatment. After that one treatment, his mom called back elated because for the first time since this child had had this accident, she saw a change in the way he was sleeping that night. He did so well that within a matter of weeks, his medication started to be tapered. At this point, he's on no medications at all. His teachers calling up mom saying, "What's going on? This is not the same child that we used to teach." His behavioral condition is just noted by anybody that knows him. And one of the more remarkable things is the doctor who had been taking care of him for so many years. And this doesn't usually happen in a clinic. It just doesn't happen. The change was so remarkable for this young man that doctor called up and said, "What in the world are you guys doing over there to this kid? Why is he so much better?" And ultimately, the doctor came over here, took a look at what we were doing, and his impression was, this is something that he really wants to get working in the hospital that he works in. At this point, I have to tell you, if you haven't already figured it out, most of the patients I get are really difficult cases. I don't typically get the easy cases. I get the cases where they've seen all their regular doctors and they're just not getting anywhere. Those are my typical patients. And, so we need everything that we can possibly get to have an effect on these very difficult cases. And these IASIS neurofeedback treatments have made such a dramatic difference. In many cases, I've just been mentioning a few, but there's a lot of cases that we've done here. And I just, at this point, I would be very upset if I didn't have this tool to be able to use on these patients, because in quite a few of these patients, it by itself has made the major difference to their outcome. When I first started using this treatment, and I was talking to a patient, I said, "You know what? I think this can help you." And I'd explain a little bit to him how it worked, and obviously people are going to be skeptical. This is a new technology. It is nothing we're used to. It's not a pill. And I'd say, I think this can work for you, and I'd like you to give it a try. Well, most of my patients respect me enough that they just will do it on my word. But these days, I don't present it to them quite that way. I just tell them flat out, "You need to do this. You will get better. This thing makes a difference." And then I can tell them a few stories like I've just been talking about here. But that's my approach to this thing. And patients, they believe in this thing now even before they walk in the door, simply because they're taking it on my word, and they're taking it from what I've seen, and I'm no longer skeptical about this technology. The treatment itself it's almost like nothing's happening, okay? I've had the treatment myself, and I can tell you that it felt like absolutely nothing was happening to me. Now, I didn't have anything wrong with me, so it wasn't like I had a symptom and then the symptom went away. But in terms of experiencing it, it's not painful. It's extremely easily tolerated. We can use it on little kids. We've used it on little autistic kids, which normally complain about everything. It's so easily tolerated and so non-invasive that I wouldn't hesitate to use it on a baby. I wouldn't hesitate to use it on any person with any illness in any kind of condition. The IASIS treatment is not a symptomatic treatment. This treatment actually is able to correct deficiencies in the brain and in the nervous system. It corrects them. So it's not just taking care of symptoms. The symptoms get better because the condition that's causing the symptoms is being treated. And very typically for us, after a patient is on 2, maybe 3 months of this therapy, they no longer need it. They don't need to come back for booster treatments. They're basically fixed, and they're back in the same condition that they were in before the accident or the trauma or whatever initiated this problem they had in the first place. I'm in this business to make people better. That's why I do this. I could make a living doing something else, I'm sure, but I'm in it to make people better. People don't get better, I'm not happy. I'm absolutely not happy. And so how does this make me feel? This makes me feel just great. This gives me a chance to see people get better that I have to say, even under my best of care, and I've been doing this for 40 years, even under my care, they would not have gotten better without this treatment. Now, I don't want to paint some kind of picture like this is a panacea for all things. It just isn't. My perspective on illness is that illness happens when there's almost a perfect storm of several different events. Sometimes it's really quite clear, like one of the patients I mentioned to you had a head-on collision, traumatic brain injury, but other times it's not quite clear exactly what are the causative factors that went into making a patient ill. But I have to say that after practicing medicine for years and years and years, one of the most significant things that happens to people that prevents them from getting well is their brain, is their nervous system. Their nervous system could be in shock for a bunch of different reasons. And you know what? We don't have a lot of real good treatments for that. You know, we've got medications, but the medications don't fix anything. They're just symptomatic care. We don't have any real treatments that fix things in that domain. And so this offers another dimension. It's another tool in my toolbox, and this is a real valuable one. And I need this tool. So one of the things that's really interesting, in fact, it's beyond interesting, it's marvelous, that is people when they have psychologically oriented symptoms. So I'm talking about anxiety, perhaps insomnia, ADD, attention deficit sorts of conditions, depression, bipolar, and what do we do with these people? I mean, how many times have they been going to therapy for 6 years? I saw a patient the other day. He's been going to therapy for 6 years. Clearly, it's not working. And he's on medications too. How many times does this not work? And the reason is there's something else going on. It's in many of these cases of depression and anxiety, there's nothing wrong with the person psychologically. People have to get that. The issue isn't always psychological. A lot of the times, it's just not psychological at all. A lot of the times, the reason they're having these symptoms is because there's a disorder in the nervous system. Same as you could have a disorder in your stomach, you could have a disorder in your knee. These are not necessarily psychological problems. And a lot of them, I'm coming to think that probably the preponderance of them are not psychological issues. Whether it's an addiction or whether it's a depressive episode, very frequently these things cannot be successfully treated until you start working on the actual balance of the chemicals in the nervous system. You can't do that with drugs. You can only do that with treatments such as IASIS and any other treatment that will affect the balance of the brain chemicals. Another indication for this that's really powerful for me is the whole idea of addictions. And I don't want to just discuss that in the sense of drug addictions or alcohol or substance abuse. I want people to think of this as just addictions, period. Addictions to exercise if you want. Addictions to sweets, addiction to overeating, addiction to not eating. These are all, the majority of addictions are there because the addictive issue is solving something for the person. It's helping them in some way. The cigarette smoke is helping them to think more clearly. The alcohol is helping them to sleep. There's something going on with those substances and those ideas that is actually helping the individual to cope. If you take that thing away and you don't supplant it with something else, they're going to go right back to the addiction. And that's the reason most people go right back to addictions, because all these addiction treatments, all they ever do is take the thing away. They don't necessarily success. They give them counseling, but very often it's not a psychological issue. Very often they need something of substance. You've got to replace it with something of substance. And so in this field of addiction is one of the major applications that this kind of technology can be used, because when you withdraw the substance that they're using, and then replace it by correcting the brain patterns, they no longer want the substance. A case would be one of the people I talked to you about a little bit earlier, and I don't even know this woman. She's a sister of one of the patients I just mentioned previously. And her mother was so happy with what has happening to the patient, my patient that we were treating, she told her daughter about this. Her daughter's been addicted to substances for years. She came in and she had the treatments. And the long and the short of it is, she actually has not had the desire for any of these substances. She's completely clean, and you know what? She's not white-knuckling it. She feels great. I've been practicing medicine for 40-some-odd years now, and I learned a long time ago that with the chronic medical conditions, there are multiple factors that go into these. They're not easy to be treated if you're going to successfully treat them. And my practice has always been, I want to get to the cause, I want to get to the problem. I actually want to eradicate the problem so that there's a clear cure with the patients that I treat. That's just the way I focus on it. It takes a lot of time, it takes a lot of endeavor, it takes a lot of expertise in various fields. You can't just be good at one field. You got to know 5 or 6, 7 or 8 fields, because any one of those fields could be involved with any one patient. That's what I like to do. That's what my practice is like. So very typically, I get very difficult patients, patients that have been through the mill with other doctors, maybe specialists of different kinds, and can't get any resolution. And those are the people that I deal with. Those are the people that I work with. And I feel strongly that the body is equipped to heal itself. I think that our bodies were designed to heal themselves. And so when a patient's sick with me, my approach to them is not so much to say, I'm going to fix you. That's not my approach. My approach is, you know what? You should be fixing yourself. Your body should be fixing yourself. What's getting in the way? What's the problem? Why isn't it working? Something's wrong. Now that something could be nutrition, it could be lifestyle issues, it could be stress, it could be pain, inflammation, whatever. It could be a multiplicity of issues, but that's what I want to focus on. I want to focus on what's getting in the way. What is it that your body needs so that it can fix you? It's designed to fix you, but it's not doing it. Something's either getting in the way and obstructing that, or it's not getting what it needs to do the job. That's always been my approach, and so I'm always looking to find out what the body needs in that particular person, or what's getting in the way.